This is Jan. She is 73 years old and has been diagnosed with hypertension. Jan's primary physician asked her to provide him daily updates on her vitals so he could monitor her and ensure she's in good health. But Jan struggles to keep up. Every day, Jan struggles to use her smartphone or tablet provided to her by her provider and set up the Bluetooth pairing with her testing devices and send medical data to her provider, spending 30 minutes or more, often quitting in frustration. Jan's healthcare provider needs to manually review the data, combing through hundreds of patients' vitals, which is both overwhelming and not a profitable use of his time. Eventually, Jan grows exhausted of the complicated routine and begins to send her vitals fewer times per week, until she eventually stops completely, leaving her provider uninformed and putting Jan at risk. This is James. He is 69 years old and has been diagnosed with diabetes. James uses the Link Plus, powered by LiveCare, to keep his healthcare provider up to date on his vitals. With the touch-free Link Plus, James checks his blood pressure, sugar, and oxygen levels easier than making a cup of tea, instantly sending meaningful reports to his healthcare provider. James' healthcare provider receives scheduled visual reports of her patients' vitals and is alerted if they fall outside critical zones set by her or LiveCare's predictive AI technology. She also receives increased revenue from Medicare and Medicaid each month for the remote patient monitoring care provided. Link Plus by LiveCare is the fastest, easiest, and most intelligent way for healthcare providers and telehealth companies to remotely monitor their patients' health. Visit our website for more information: www.livecareusa.com.